Hi, I'm Charlotte Montgomery, and I'm going to explain what H. pylori is and how it affects microbiology. What is H. pylori? There's a little picture that kind of shows you what H. pylori is. H. pylori is a bacteria that lives in human stomachs. They affect the lining of the stomach as well as the organ. The bacteria can enter through the digestive tract, and about 2/3 of the world's population actually have H. pylori. How does H. pylori relate to microbiology? H. pylori is a gram-negative bacterium. It is microaerophilic, meaning it does need oxygen to live. The shape of H. pylori is a spiral, and it's demonstrated in tissue by gram stain. There are 4 to 6 phalangia on the back of the H. pylori bacteria, and it helps move the bacteria through the stomach lining. How does it get into your body? Well, it is passed through fecal to oral route, meaning it has to be through your mouth and into your stomach. Where does H. pylori call home? As you can see, the stomach is in the left upper quadrant of your body. You can see the less curvature. Let me go back. The less curvature, the greater curvature. And you can see that it houses into the stomach lining and lives there. That's where it calls its home. You can see there's a small picture right there. Small picture right there of what the infection looks like. So 2/3 of the world have H. pylori. So who are prone to H. pylori? People that are prone to H. pylori live in third world countries. They don't have access to clean water or food. Populations that are usually in poverty have H. pylori. Any crowded or unsanitary conditions could have H. pylori. Living with someone that has H. pylori, they could get H. pylori from living in small quarters with people that have H. pylori. It can be spread. If I had H. pylori and I use a utensil in the kitchen, and someone in my household uses that same one, they can get H. pylori. It, like I mentioned earlier, it is spread by fecal to oral mouth. So children are more prone to get H. pylori. Adults can as well, but children that don't wash their hands can get H. pylori. Symptoms. Symptoms include pain in the upper left quadrant of the body, vomiting blood, having blood in stool, also any nausea that you have. These symptoms are kind of vague. They could mean other things other than H. pylori, so it's important to go and get tested, which we'll talk about in a little bit. Diagnostic. So how do we get diagnosed? Medical history. Who in your household has H. pylori that you could get H. pylori from? A physical exam. Doctors will feel around your stomach and see where that pain is. any stool test to see if there's any hidden blood, and then an upper gastrointestinal endoscopy, which would be a camera that is placed down into your stomach to look around for any symptoms. Of course, a CT scan and biopsies are mainly done when that camera goes down and they take a little bit of tissue out to examine. Well, what is the treatment if you have H. pylori? Antibiotics usually will take two forms at the same time. They have amoxicillin, flagyl, and other antibiotics that you can take. Proton pump inhibitors, they're very important. They reduce the acid in your stomach, making it more comfortable and helping your symptoms that you have. Some of those would be Prilosec, that can definitely help, or Protonics. Well, how do we prevent from getting H. pylori? Washing hands are very important. If you wash your hands 20 to 30 seconds and seeing the ABCs, that will definitely prevent it. Avoiding dirty water, dirty food that isn't cooked all the way as well. Avoiding any milk, chocolate, or spicy foods will help with the symptoms in case you develop an ulcer in your stomach. And make sure you always see a doctor regularly. That looks like it concludes to what H. pylori is. This is curable, but it can lead to some deadly illnesses such as cancer. So it is very important to go see a doctor if you're having any symptoms and getting tested to make sure that you don't have H. pylori. Thank you for listening to my presentation of what H. pylori is. I appreciate it so much. Thank you.